Now, if there's one slide you're going to remember from this talk, it's this. So about half of pregnancies in this country are unplanned or mistimed, which means that if you're prescribing a psychotropic medication for a patient and she is of reproductive potential, so she's not planning pregnancy, there's a really good chance she's going to become pregnant on that treatment. So many women find out, by surprise that they're pregnant. It's often, a very uncomfortable surprise if she's on medication. Oftentimes, she's very panicked. Should she continue? Should she stop? Oftentimes, women will stop medication abruptly. Oftentimes, the prescribers are not prepared as well for this. But it's incredibly common that women become pregnant, sort of by surprise. The other issue with that is, again, because many of the conditions we treat are chronic or recurrent, many women will change their plans for having children during the course of treatment. So a woman may come in and not be at all close to deciding to start a family, but then, the cool thing is she gets better. She's on treatment, she is well, she's maintaining and doing, great. She's ready to start a family, and then it's really a bind if it turns out she's on medication that would not be reasonable to move forward in terms of starting a family. So from the very beginning, for girls and young women, we want to make sure that pregnancy considerations are always a factor in terms of selecting treatment from the very beginning, so that if a woman has a surprise pregnancy or she decides she's going to become pregnant, we're not in a bad situation of either having to panic, having her stop medication, or having to start over with medication trials at a time where she may actually be pregnant, because pregnancy is a terrible time for medication trials. It's all about risk-benefit, and so if the benefit's not there, there's absolutely no reason to accept any risk. It's really important, again, if you're going to remember one slide, as you write prescriptions for women of reproductive potential, be thinking, this patient has a good chance of becoming pregnant on the treatment I'm prescribing.